Hello, I'm Anton Alerte, and I'm here with you again to talk about written assignments in doc and clinical home. Now, the written assignments are in two big families. The first one is probably one that you'd expect, and those are your patient write ups. And those write ups are based on your patient encounters, either in your click setting, or at the hospitals, or in any other environment that requires a write up. And the format is pretty much standardized. For example, this is a 42-year-old diabetic female who presents with severe chest pain over 2 hours duration, etc., etc. Now, the guidelines and how to put those together will be clearly delineated in your syllabus, and your faculty are there to help you learn how to put all that information that you collect in a great written format that you can use to communicate to peers, colleagues, now and in the future. The second type of written work that we expect is something called reflective or professional journals. All right? They're professional journals. They're there to help you interpret, synthesize, and make sense of all of the things that happen in medical school. Because the stuff that changes you is not strictly what's in the syllabus. For example, if I asked you, oh, how was it at Notre Dame? Or how was it at Yale? Or how was it at UConn? You wouldn't say Organic Chemistry 1, Organic Chemistry 2 of the lab, Physics 1, Physics 2, English Lit 1, Archaeology, and Histology. That wouldn't cover it. What happened in college, what changed you, what motivated you, what made you a different person walking out at graduation than it did walking in at orientation was all the stuff beyond the syllabus. And guess what? That doesn't change in medical school. In fact, some of the things that you see, hear, do, experience are much more profound, okay, than some of the stuff that you might have done in college. That being said, it's good to process those things. And a written format is a great way of processing those things. Now, for those of you who aren't keeping journals and blogging as part of your natural course of existence, we've got a format to help you out. It's called IDEA. IDEA. And for most things, it helps structure what we'd expect your written work to look like. The I stands for idea. Pretty much just give me the title line, like, a patient got really angry at me, or the patient walked out of SCP. The D is the description. Tell me what happened before, tell me what happened after. She was late for her appointment, or she was really sick, or the doctor gave her bad news. The A is assessment. Why do you think it happened? Why do you think your doctor reacted that way? Why do you think the patient acted that way? You know, what information and knowledge helps you interpret or assess the situation that was profound enough for you to want to write about it? And the E is for evaluate. Tell me what you think at the final end. Once you've kind of had time to kind of think about it, what do you think this taught you about how you're going to act as a doctor in the future, or how other patients should react? Pretty much tell me what you plan to do in the future if the situation arises again. All right? Now, one struggle that students have told me over the years is, I just can't think of anything to write about. Nothing happened in SCP. Nothing happened in Click in its new iteration. Well, look, if you can't think of anything that's happened in your life, be it in med school, in your clinic, in the hospital, or in your life in general, that kind of changes you or influences you or gives you pause, my only advice is think again, because there really is. All right? So these assignments, if you need guidance, your faculty are there for you. If you need help figuring out ideas or fleshing out ideas, we're here for you. And as part of the wrap-up, your professional journals will be read out loud from time to time. Now, that's not meant to put you on the spot. That's not meant to lay out your open soul in front of everyone to mock. No. Sometimes it's really good to get another person's opinion, to get another person's perspective when you're thinking about a process or thinking about a situation. And the teams are designed to give you that opportunity and to give you that venue. So use them wisely and use them as they're intended. They're there to kind of help you process what happens. All right. If you have any more questions or have any more concerns, please feel free to reach out to your preceptors or your course directors.